Hello, my name is Sadie Morway. I'm a doctorate and athletic training student at Indiana State University. And today with me, I have Nick.
Hi.
And Nick is going to be helping me demonstrate a mobilization with movement for the ankle. So this is at the talocrural joint. And this technique specifically addresses decreased ankle dorsiflexion. So it can be applied post-injury or it can be applied for patients that maybe have a positional fault at the ankle. So the mechanisms that this technique works through are a few things. One, it helps to align that talus. So often we see an anterior shift in the talus, and ideally we want that talus to be more posteriorly oriented. So this technique helps to get that talus back into a more appropriate alignment. And then also the sensory motor stimulation can help with postural control as well. So these are two areas that you can focus on with patients. And then the last piece of mobilizations, there's a lot of research that shows that the descending pain pathways are initiated with mobilization. So these are a few different things that you can apply to your own patient populations. The type of equipment you'll need is a table. You can do this on the floor as well. It's a little bit easier when you have a table. But so what we're going to do is I'm going to have Nick go ahead and go into a tall kneeling position here. So you're going to have the affected ankle up here. So in his scenario, it would be the right side. And this table won't break. So we're going to be using a belt. So this is another piece of equipment you'll need for this technique. And I like to use some kind of padding underneath that helps with any slipping that you might have with the belt, and also helps the patient be a little bit more comfortable where that belt is on their ankle. So is your knee okay? Mm-hmm. Do you want a pad under it?
No, it's okay.
Okay. So the strap is wrapping around the clinician's waist. I'm gonna put this towel here, and we're just clipping around. So you want a good amount of distance so that you're not like face in the knee of the patient. So you want the ability to be able to sit back. So this is around just the distal part of the tib fib. So the goal here is really I'm pulling my weight, so I'm shifting that tibia anteriorly as he's going to be going through a range of motion. So Nick, you're going to be kneeling into dorsiflexion. Don't let your heel come up. If you get to any point of pain, you can come back. If you get to any point of pain or restriction, just come back from that. So you're going to be getting that anterior positioning here. At the same time, I'm holding that talus, I'm blocking it so that it's not able to shift anteriorly at all. It's ideally in a neutral or even getting shifted into that posterior positioning. So, all right, Nick, once I get my footing here, okay, go ahead and shift forward and shift back. Don't come quite that far next time because your heel's coming up. So go ahead and go again. Good, that's good, and back. Good, so this is just a nice slow cadence. You keep going at that pace. And anytime you're introducing a new mobilization with a patient, you want to start with anywhere from 1 to 2 sets, anywhere from 6 to 10 repetitions. So we're just going to go through one set as the demonstration, but keep that in mind when you're integrating a new mobilization. You don't want to do too much too soon. So really see how they respond to it. But again, letting them know it shouldn't have any pain. In fact, they should be hopefully getting some pain relief as we get through this. Let's get one more here, Nick. Good. And last one, and back to neutral. Good, and that is the mobilization with movement for the talocrural joint, and that's for an anteriorly positioned talus. Thank you.